And as we head into the new year, Toronto's top doctor is promising new restrictions that will be announced next year. Tonight, we take a look at what that could mean and what needs to be done to get the second wave under control.
I think January is going to be awful. It's the darkest month, literally, and I think it's going to be one of the darkest months figuratively.
The numbers are staggering. In the last day, almost 5 dozen people have died. Dozens more have been admitted to the ICU. Thousands have tested positive for the virus, and it's too soon to consider this the so-called Christmas surge.
If we're thinking about what happened that first weekend before Christmas, obviously visiting and transmission is going to continue to climb. So unfortunately, I'm expecting a steep climb from here on in over the next few weeks.
As Toronto has been seeing close to or above 1,000 cases a day, the city is promising new restrictions starting next week that will be added on to the existing lockdown rules. Chief Medical Officer of Health, Dr. Eileen de Villa, says they will focus on stopping the spread of COVID-19 in workplaces, but few details were given. What more can be done?
I don't want to speculate. I would not want to be in her shoes right now because I think it actually has to be a little bit more extreme. I think we may need shelter in place or stay at home orders. We may need to shutter all businesses except for grocery stores. And if we don't, if we choose not to, then we may end up looking like it did in New York City, like it did in Northern Italy, where death piles up.
The test positivity rate for all of Ontario now sits at 5.7% and is much higher in the GTA hotspots. Toronto, Mississauga, York Region, Windsor-Essex, and Ottawa are all seeing a significant rise in numbers. ICU beds are also filling up with 337 now occupied by COVID-19 patients. 210 people will be starting the new year on a ventilator. Or what is your confidence level that this province-wide lockdown will have the results that we're looking for?
We have a rapid rise in cases, and an approach like this may provide some temporary relief and at least flatten out the rate of new cases, which is welcome. We need that. We need that. But we also need a lot more than that, right? You can't sustain 3,000 new cases per day. You can't sustain 2,000 new cases per day. And not expect your healthcare system to get stretched beyond capacity.
As more and more vaccines go into the arms of healthcare workers and long-term care residents, experts warn we're still in the thick of it, and the winter will likely be long and tough for many of us. Do you think life will be getting back to normal at some point in 2021?
So by the time we hit summer, I think life is going to start to feel not quite normal, but certainly a lot more hopeful, and really hopeful in that we won't be facing another wave in the fall. That once we hit that summer solstice, it's going to keep getting better every day, and it's never going to get worse. That's my belief. That's my hope.
Now, the province-wide lockdown started just 4 days ago. What we're seeing now is the lead up to the holidays. Next week, we'll likely be seeing the Christmas surge. And by mid-January, we should be seeing the results of the Ontario shutdown.